Multiple personality disorder is a complex psychological condition that occurs in up to 1% of the general population. Individuals suffering from multiple personality disorder have two or more identities known as alters or personality states that continually have power over a person's behavior. The transition between alters, known as switching, can occur abruptly, sometimes triggered by stress or environmental cues. Individuals with multiple personality disorder often experience gaps in their memory, finding themselves unable to recall personal information or events, especially those related to a particular alter. Different identities can have their own age, sex, or race. Each identity has its own mannerisms, posture, gestures, and distinct way of talking. Names, voices, and personal histories may also differ from each other. Patients often have gaps in memory of past personal events. Multiple personality disorder is caused by many factors, such as severe trauma, repetitive physical, sexual, or emotional abuse. In about 90% of cases, there is a history of childhood abuse. Switching off from reality is thought to be a coping mechanism for trauma. Multiple personality disorder is diagnosed about 6 times more often in females than males. Patients with this disorder can suffer from anxiety and panic attacks, and some of them can show suicidal tendencies and other symptoms of depression. Individuals may commit criminal acts while in a dissociated state. Patients have been known to develop more and more alters as the disease progresses, sometimes starting with just 2 or 3 alter personalities, and it can develop up to 100. 50% of multiple personality disorder patients harbor fewer than 11 identities. About 1 in 3 people with multiple personality disorder suffer from hallucinations. The average age for the initial development of alters is 5.9 years old. Multiple personality disorder can sometimes develop as a side effect of another mental illness, such as post-traumatic stress disorder or borderline personality disorder, which complicates the diagnosis of multiple personality disorder as the symptoms often overlap with other mental disorders. Treatment for multiple personality disorder typically centers around long-term psychotherapy, with the goal of integrating the different alters into a cohesive sense of self. This often includes carefully processing traumatic experiences, developing healthier coping mechanisms, and building a stronger sense of identity. Due to the severity of the underlying trauma and the fragmented nature of the condition, treatment can be lengthy and challenging. However, with the right support and therapeutic approach, individuals with multiple personality disorder can experience significant improvement, leading to better integration of their alters, greater stability, and a more fulfilling life. Medications are sometimes used to treat other symptoms such as depression. Always remember that individuals with multiple personality disorder have endured unimaginable pain, and they deserve understanding and compassion as they navigate their path to healing.